And welcome to part 2 of the presentation. So we're going to start with positioning for today, then we're going to do rests, then we're also going to look at oxygen, then we shall end with fluids. Then part 3 will finish up everything that hasn't been discussed in this presentation. So without wasting much of your time, let us quickly look at the first part, which we're going to cover, which is positioning. So like always, these we're following the epiphonema, right? So remember, positioning is also part of epiphonema. So shall we begin? So under positioning, and keep in mind that we're still looking at management of a patient with an asthmatic condition. Yes, so this is part 2. Yes. So now let us look at what we have under positioning. So in case you missed part 1, for you to have a follow through what we are discussing here, you should also refer to part 1, then you come to part 2. Okay, let us now begin today's presentation. So when you're looking at positioning, what are we mainly focusing on? So under positioning, you're going to nurse Mrs. Perry in high Fowler's position to 60 to 90 degrees. So the main rationale here is that upright positioning maximizes lung expansion. Then another point is I will use tripod position, leaning forward with arms supported on an overbed table. The rationale here is that the tripod position reduces work of breathing and improves ventilation. Then the next part is I will avoid flat laying on the back position because it makes breathing more difficult. So the main rationale here is that supine position restricts chest expansion. The other point under position is I will allow her to choose the most comfortable upright position during the attack. So the main rationale here is that comfort reduces anxiety and it also promotes effective breathing. So we are done with positioning. Let us now look at rest. So under rest, I will encourage adequate bed rest during the acute attack because breathing requires a lot of energy. So the main rationale here is that rest conserves energy and reduces oxygen demand. Then the next thing is I will cluster nursing care activities so that Mrs. Perry gets uninterrupted rest periods. So the main rationale is that it minimizes fatigue and also promotes recovery. The next thing that we're going to look at under rest is I will teach her energy conservation methods or techniques such as sitting while dressing and bathing. So the main rationale here is that this reduces exhaustion and also prevents breathlessness. The next point is I will reassure her that rest reduces oxygen demand and helps recovery. So our main rationale here is that psychological reassurance also promotes compliance with rest. The next part under our epiphonema is oxygen, under management of asthma to say. So remember, you're managing a patient in accordance with the presenting condition, should I say presenting symptoms. So oxygen is essential because this patient has a respiratory condition. So under oxygen, I will monitor oxygen saturation every 30 minutes during the acute attack and every 4 hours when stable. So our main rationale is that this detects hypoxia early and guides therapy. Then the next thing is I will give humidified oxygen at 2 to 4 liters per minute through nasal prongs if oxygen saturation is below 92% as prescribed by the doctor. So the rationale here is that oxygen relieves hypoxia and also humidification prevents mucosal dryness. The next thing that you need to focus on under oxygen is that you use a face mask if hypoxia is severe. So the main rationale here is that it provides high oxygen concentration for severe cases. Then another thing that you also need to consider when you are under oxygen is that you should also teach Mrs. Perry. So you also teach Mrs. Perry pause deep breathing and deep breathing exercises to reduce air trapping in the lungs. So our rationale is that it improves ventilation and prevents collapse of the alveoli. Then we also have the part where you need to monitor her response to oxygen therapy. So this ensures effectiveness and safety of treatment. So the other part under our nursing management, we're going to focus on fluids. So this is what we're going to conclude on today. So under fluids, I'll encourage Mrs. Speary to take 2 to 3 liters of oral fluids daily to liquefy secretions. So adequate hydration thins mucus and aids clearance. Then under fluids, I'll give warm fluids because they help loosen sputum. So the main rationale is warm fluids soothe airways and mobilize secretions. Then I'll also monitor the intake and output charts and urine outputs to check for dehydration. So our rationale, this prevents fluid imbalance, guides therapy, and also the other intervention is I'll give intravenous fluids as ordered by the doctor if she cannot take fluids orally. So our main rationale here is that this maintains hydration when oral fluids intake is compromised. I think we can also add nutrition. I think we can end on nutrition for today. Yeah, I was planning on ending on fluids, but I think we can kick nutrition in as well. So under nutrition, I'll give Mrs. Speary small frequent meals because a full stomach pushes the diaphragm up. So rationale, this prevents retraction of the lung expansion. Then I also provide a high protein, high calorie diet if she is underweight due to chronic asthma. So the rationale, this promotes tissue repair and energy balance. Then I'll also advise her to avoid foods that trigger her asthma, such as foods with sulfites, nuts or dairy if she is allergic. So the rationale is that this prevents induced asthma attacks. Then I'll monitor her weight and body mass index weekly. So the rationale, it detects nutritional status and guides dietary adjustments. Then lastly, I will encourage foods rich in vitamin C and a balanced diet to boost immunity. So the rationale, this strengthens the immune system and reduces infections. So this marks the end of today's short presentation. We are going to conclude in part 3. So in part 3, that's what we're going to discuss the exercises, the medical and medicine management. Then we're also going to discuss the activities and ambulation. Then we're going to end with the investigations and conclude on the information, education, and communication. So for today, this is it, and see you in the next presentation. Thank you.